Welcome students. Today's topic is different from the regular topics or the regular studies, and the topic is the coronavirus. Everybody know about the coronavirus. In the present video I will try to give the more information regarding the coronavirus. It is more efficient if the word virus is replaced by viruses. Why? Because the coronavirus is not a single virus. It is a group of viruses having the related RNA. Everybody know about the RNA. This is ribose nucleic acid. Generally there are two types of the nucleic acid. One is DNA and other is RNA. In higher organism, DNA is present as a nucleic acid or nuclear material in the cell. But in lower organism like bacteria, viruses or in a microorganism, RNA is present as a nucleic acid. This virus is very dangerous because it causes disease in mammals. Like in cows and pigs, it causes the dysentery, means diarrhea. It is the infection in the intestine that causes to pass a lot of liquid waste in which blood and even mucus are mixed. In case of chickens, it causes the upper respiratory tract disease or infection. That is in case of chickens. And in case of human being, these viruses causes mild to lethal illness. Mild means छोटे से cold या कफ के infection से लेकर बहुत बड़ी बड़ी lethal disease भी कर सकता है. That causes the death of the person. If we consider the mild infection or the mild illness, that is the common cold. This common cold is caused by rhinoviruses, while the lethal illness include MERS, SARS, and one of the today's disease, that is the COVID-19. MERS stands for Middle East Respiratory Syndrome. SARS means severe acute respiratory syndrome, and one of the most important जो आजकल problem है, that is the COVID-19, and today's we discuss COVID-19 in a detail. Before we discuss about the COVID-19, firstly we discuss about the virus classification. Means virus किस kingdom से, किस phylum से, class, order, family, subfamily और genre से belong करता है. First of all, kingdom, and the kingdom is Orthorhynvaria. Second one is phylum, that is Pisuviricotta. Third one is class, that is Pisoniviricetes. Order is Nidoverllae, and family is Coronavidae. Subfamily, that is Orthocoronavidae. And one of the most important is the genre. Means इसकी generations आगे जो इसका वंश है, that is alpha, beta, gamma and delta. Alpha coronavirus, beta coronavirus, gamma coronavirus and delta. Now we come on the topic, that is the COVID-19, or the other name is 2019 NCOV. Means N stands for novel, CO for corona and V for virus. Means 2019 novel coronavirus. Same the COVID-19 expand. Here the CO means या stands for corona, VI for virus, D for disease, and that disease 2019. It also known as the Wuhan disease or Wuhan corona disease or virus. Why it is called the Wuhan coronavirus? As it was first identified in December 2019 in Wuhan, China, and then spread globally. And the other name is SARS-CoV-2. Why it is known as the SARS-CoV-2? Because the 70% of the genome sequence in that virus is identical with the genome sequence as present in the SARS virus. And the researchers believe that it spread through the animals like bats, snakes, and pangolins. Because first case that identified in Wuhan, that China, in seafood market of the Wuhan. So the researchers considered that maybe it spread through the animals. Now we discuss about the symptoms of the COVID-19. Generally the symptoms of COVID-19 divided into three categories. First is the common symptoms. Second one is uncommon or less common symptoms. And third one is the serious symptoms or severe disease symptoms. First, the common symptoms like fever, dry cough and fatigue, tiredness, थकावट महसूस करना, and the range of the fever temperature, that is 37.8 degree Celsius. The normal body temperature is 37 degree Celsius and there is increase of 0.8 in common symptoms of COVID-19. And the less common symptoms are headache, throat infection, pains, nasal congestion, sore throat, diarrhea, loss of taste and even smell, rashes on the skin, discoloration of the fingers or toe. Now third one is the serious symptoms and that include the confusion, means mental confusion, bluish face or lips, difficult in waking, cough with blood, means coughing with blood, persistent chest pain, decrease in WBC's count, white blood cell decrease कर जाती हैं, kidney failure, high temperature means high fever, more than this 37.8 degree Celsius, loss of speech and even movement. On the basis of these symptoms, WHO make a systematic study and divided the infected person into the different categories. And there are these four categories. First, mild cases. That area is quite vast. And these patients are hardest to count. Means इनकी तो कहीं गिनती ही नहीं की जाती. बहुत mild cases इनको consider किया गया. Next is the 80% cases having some mild symptoms like fever, cough that easily recover without any treatment. And next is the 14% cases that develop the serious or severe symptoms like difficulty in breathing, shortness of the breath. इस तरह के जहाँ पर symptoms होंगे, that cases include the 14% of the patient or the infected person. And next, one of the most dangerous is the 6% cases, and these are the critical cases that have chances of the death. And these 6% cases include the risk zone, means elder persons or the persons which are previously ill, like they may be asthmatic, maybe heart problem, maybe diabetic. And in that cases, the attack of coronavirus causes the lungs failure, septic shocks, and even the different organ failure. And one thing is, always remember that in severe or the serious symptoms, the cough is not normal. The cough is quite dangerous because the infected person continuously cough for an hour, and such type of attacks repeated thrice in a day. और इन सभी सिम्टम्स को रिकॉग्नाइज होने में और शो करने में कम से कम वायरस 1 to 14 days का टाइम पीरियड लेकर चल सकता है. मीन्स द इन्फेक्टेड पर्सन कैरी द वायरस फॉर 2 days और up to 2 weeks. 2 weeks means up to the 14 days before noticing the symptoms. And now one of the most important question in our mind is that how this infection transmitted. As we know, the COVID-19 is an infectious disease that easily transmitted from infected person to the healthy person through the respiratory droplets. The respiratory droplets of the infected person contains the COVID-19 virus, means coronavirus, that passes the infection into the healthy person. Sometimes these respiratory droplets fall on the objects or on the surfaces like plastic, metallic objects, and they survive on these surfaces for the different time periods. And when the healthy person touch or come in contact of these objects or the surfaces and then touches the nose, eyes and mouth area, then the infection transmitted to that healthy person. Now the question is, how long does the virus survive on different surfaces? The different surfaces have the different time period for the survival for that coronavirus. For example, 72 hours means 2 to 3 days on the plastic object like buttons, detergents, bottles, stainless steels object like refrigerator, and even the pans, sinks, water bottles which are made up of the stainless steel, and even the handles of the door. Less than 4 hours on the copper objects, less than 24 hours on the cardboard like the shipping boxes are made up of the cardboard, and the survival hours are the 24 hours means 1 day. 2 to 8 hours on aluminium object like aluminium foil, up to the 5 days on the glass like drinking glasses, cups, mirror, window pans that are made up of the glass, and up to the 5 days means less than 5 days on ceramic like dishes, pottery and the mugs. And there is no any survival rate of that coronavirus on food and water. Now we discuss about the prevention of COVID-19. आपने सुना होगा प्रिवेंशन इज बेटर देन क्यूर. मीन्स कोविड-19 का अभी तक कोई भी इलाज पॉसिबल नहीं है. सो इट इज़ बेटर टू प्रिवेंट दैट कोविड-19, एंड देयर आर डिफरेंट वेज टू प्रिवेंट द कोविड-19 लाइक stay home. When we stay home, then we save the lives and help to stop the spreading of the coronavirus. Secondly, keep a safe distance, means there is the proper distancing between the two persons so that there is no transfer of the infection from one person to another. And the third method of prevention is the wash hand. That is one of the most important. The washing hand should be properly in a proper steps, like first we clean our palm with the soap or the hand washes, then the back side of the hands, and after that in between of the fingers like this, then finger tips like this, then rubbing the thumb in order to clear it, then wrist part of the hand. Means these steps are necessary during the washing hands so that each and every part of the hands should be cleaned. Next one is the cover your mouth during the coughing and sneezing with your bent elbow or by tissue paper or with the help of the hanky, and even use the mask, means cover the mouth when we move outside the home. Next one is the use of mask. Generally the person which are present in the risk zone, they use the mask like N95, N99, FFP2. These are the surgical masks. Normally we use the simple cloth in order to cover the mouth. And one of the most important, if anyone have fever, cough or difficulty in breathing means symptoms of COVID-19, then immediately seek medical attention without any delay and follow the directions of medical and health authorities and avoid unnecessary visit to the medical facilities. Why? Because the medical facilities are busy to treat the COVID-19 patients. If we create the problem, then it is very difficult to work with a proper devotion by the medical facilities. एंड रेगुलरली क्लीन द थ्रोट, गले को रेगुलरली साफ करना चाहिए. एंड वन ऑफ द इम्पॉर्टेंट इज बूस्ट ऑफ द सेल्फ इम्यूनिटी सिस्टम विद पॉजिटिव थॉट्स एंड एक्सरसाइजिंग डेली. नाउ अगर हमसे कोई पूछता है कि व्हाट ट्रीटमेंट्स आर अवेलेबल फॉर द कोरोना वायरस और फॉर द COVID-19, देन there is currently no treatment for COVID-19. Coronavirus are treated by managing the symptoms by using maybe antiviral drugs. Breathing supports provide कर सकते हैं with the help of the mechanical ventilation. Steroids दे सकते हैं in order to reduce the lung swelling, because the coronavirus affect the breathing system or the respiratory tract, that causes the swelling to the lungs. So the steroids are provided to reduce the lungs swelling. And जो आपके पास ब्लड है उसके अंदर जो प्लाज्मा है उसका ट्रांसफ्यूज़न किया जा सकता है इन ऑर्डर टू प्रिवेंट द डिफरेंट बॉडी ऑर्गन फेलियर. आई होप आपको ये वीडियो समझ आएगी और आपको हेल्प करेगा फॉर द COVID-19 क्विज दैट ऑर्गेनाइज्ड सून. एंड hope for the best. Thanks and have a nice day.